like it, the whole hour and a half where I go into depth on a whole bunch of things is on my YouTube channel, and you can watch it. And in fact, all my public speaking that I do will start to become on my YouTube channel. And that way people can look at any topic they want that I will, because I have about 20 different public speaking topics over the next couple months that I'll be doing, and they'll all be videoed and for free on YouTube. Okay, so yes, I got my master's in public health. I'm a certified health education specialist, and I'm also a licensed massage therapist. That allows me to touch people in this state, because even though in this state I can only be a natural health consultant, I still want to be able to touch you, to be able to see if I can figure out, any physical ailments, and that allows me to legally do that in the state. And then I'm also a program management professional because of my engineering degree. Okay, so this lecture is Aging Gracefully. I'm going to talk about the top 6 concerns or health concerns that cause death in people 65 and older and 85 and older, and we're going to focus on one of those today because there's a lot to it. Okay, so let's see here. This is the disclaimer. It's just to let you know that in this state, while I am a licensed primary care physician in other states, I am not a licensed primary care physician in this state because Tennessee does not legally allow naturopathic doctors to be physicians. 26 states and jurisdictions do allow us to be licensed primary care physician, and in fact in Oregon and Washington, insurance will cover us. So, it's slowly moving from the west to the east, but Tennessee is a holdout along with like Alabama, Mississippi, and Texas, and some others. But it's slowly coming this direction, so I'm hoping not too long we'll be able to be licensed. So the philosophy of naturopathic doctors, we follow what's called a therapeutic order. So this is just a brief discussion of what naturopathic medicine is, but basically we always, see if I can use my new laser pointer. Wow. All right, so we always start at the bottom, which is the determinants of health. And we try to, our philosophy is that people have an innate ability to heal, and when we get sick or we have problems, it's because we've gotten out of balance. And if we can figure out what's causing us to get out of balance, we can direct our body to go back into balance on its own. So for example, if you have mercury poisoning, no matter how many supplements I give you, no matter how much good food you eat, if you don't get the mercury, if you don't get it out of your body, then you're not going to heal. So that would be an obstacle to cure. So the first thing we do is we start at the bottom and we try to remove the obstacles to cure. Then we build upon the foundation and make sure you have all the nutrients and cofactors you need, and then we move higher and higher up in the therapeutic order as we try to treat someone's condition. And so, like, even botanical medicine is a little bit higher. That would be right here. It's more natural symptom control. So I wouldn't start out with giving you botanical tinctures because that's pretty high up. I would start lower to see, why you're out of balance in the first place. Okay, so let's go on. So this is just a slide showing that our population demographic is changing. We basically we're getting older. So more of our population is older, and that means we need to stay healthy longer if we want a good quality of life. Now this one was, it's an interesting thing. If you look, it's now 1960, now 1965, it's going to be 1970, and what you're looking at is the age distribution changing as the decades every 5 years go by. But what you're seeing is younger people are getting less, and the older people are getting more. So it's just the same information shown a different way. And it's pretty dramatic though. As you see, it's 2010, 2015, and our population, definitely more old people. So we need to work on staying healthy as we get older. Okay, so what are the top 10 leading causes of death in people over 65 and over 85? So over here on the left, we're looking at over 65, and then over here is over 85. And my graphics didn't show up on this computer the right way, but that's supposed to be a number 1, a number 2, and a 3, and a 3, and a 4. So basically for both 65 and 85, heart disease is number 1. And then cancer, and then we have like Alzheimer's, so cognitive decline, but at number 3 is more of a lung conditions, respiratory issues for 65 and older. Then we have stroke is number 4 for both. And then we have Alzheimer's disease is 5 over here for 65, and then diabetes, and then we have more lung issues over here, and then kidney and unintentional injuries. So they're pretty much the same. Diabetes is a big difference. If diabetes is going to get you, it gets you younger. And if you can make it to 85, usually, it's not gonna get you. So that's sort of how that distribution goes. So we're gonna talk about the number one killer for both of them, which was heart disease. So heart disease is a term that encompasses a whole slew of different conditions, including coronary artery disease and this whole list here. And most of us are pretty familiar with all of these, but they're all related, and even stroke, it's all has to do with vasculature. So we're going to talk about what are we had to distill down to the essence, and that's what this talk is, because we don't have a whole lot of time. What are the top 2 or 3 things we can do that are the highest yield things that you can do at home to reduce your risk of succumbing to heart disease? And so that's what we're going to talk about. Okay, so this gentleman here is Dr. Blanchette, and he's one of my heroes. I love this man. He's awesome. He's an MD, and his name's Dr. Blanchette, and he has a big practice in Colorado, and I really subscribe to his theory of heart disease. And then also Thomas Levy, who wrote this book right here, he's another one of my heart disease gurus, and he's also not an ND, he's an MD. So these are both MDs, but they have really figured out heart disease in my mind. So Dr. Blanchette has thousands of patients, and he only treats people with heart disease. That's his specialty. And 90% of his patients, he's found that if he can solve 2 different issues with them, then their heart disease that goes away. Their risk of a coronary event drops down to virtually 0. And those 2 things are basically mouth hygiene, so oral hygiene, and sleep. So if you can address those 2 things, 90% of his thousands of patients do not suffer a coronary event, which is a huge thing to say. And most people have no idea, they don't realize how important those 2 factors are. So we're going to talk about it, but Dr. Levy here also in this book, he wrote a whole book on what he calls the hidden epidemic, which is hidden dental abscesses, which many times you don't even know you have a hidden dental abscess. They're painless, but because of where, especially on the lower mandible, it will the arteries that are in the jaw down here are very close to your carotid artery, which goes straight into your heart. And so the pathogens that have been found in the plaque in your carotid artery they've done DNA sequencing on that plaque, and it's the same DNA, it's same from the bacteria in your mouth. So and I can describe a little bit more of how the etiology or how that happens. Let's see here. Let me keep going. I should have taken that slide out. Okay. So the link between gum disease, heart disease, and stroke. So what happens is, if you read over here, people with gum disease are twice as likely to have heart disease. Those with acute ischemic stroke are more likely to have gum disease. So basically they're showing that there's an association between your mouth and your heart. And that's the big point that I want you all to walk away from this 25-minute lecture here, is that how important your mouth health is. I don't care how pretty your mouth is. I don't care if you have pretty teeth, but I do care about your heart, because it's the #1 killer. So if you brush your teeth and your gums bleed, that is an open wound, and that is like an open door for the bacteria in your mouth to swim their way up to all these arteries, which I'm going to show here in a second. I think I have the next slide. Okay, so this is just saying what I'm just saying right now, which is the bacteria in your mouth make it into your arteries, and they cause a systemic inflammation. So let's say you have, this artery right here is the inferior alveolar artery, and it goes right here, right into your internal carotid, and then into the common carotid. And so it's a very short path from that bacteria that's in your mouth to get to that. And what happens? Who cares about bacteria that makes its way from your mouth into your arteries? Well, what happens is that bacteria causes a systemic inflammation in the blood, and so when you're inflamed, it'll cause the endothelial lining of your blood vessels to become inflamed. And it's sort of like an Indian burn. So like, when you're a kid, somebody grabbed your arm and twisted it, and you get an Indian burn on your skin, and then it won't usually bleed, but if somebody did it really hard, then if you remember as a kid, at least I remember, this little yellow pus will start coming up onto the, it's like this like starts dripping a pus, if they did it hard. Well, that's a reaction from being inflamed. So first you get the red inflamed skin, and then you get the pus. Well, the same thing happens on the inside of our arteries. So when you have this pathogen, this bacteria that's from your mouth, that's now into your carotid artery and basically all of your vasculature, it causes the inner lining of your blood vessels to become inflamed. And then when they become inflamed, your body wants to fix it, and so it starts oozing out cytokines and other things to try to seal it up, to try to heal up, because what happens is the endothelial cells that line the blood vessels start leaking. When they're inflamed, they start becoming open, and then all kinds of problems start happening, and your body wants to fix the problem. And so it does that by becoming sticky. And then when it's sticky, you have calcium in your blood, and you've got lipids in your blood, and it starts sticking to the wound. Well, the wound in this case is the entire inside of all of your blood vessels, right? Because you have inflammation from the bacteria. So you've made all your blood vessels on the inside inflamed like a wound. So you really, really don't want bacteria, a constant drip of bacteria from your mouth going into your blood. So to summarize, if your gums bleed, you need to fix it. It's one of the best things you can do for your heart, is to make sure your gums don't bleed when you brush. Okay, so that's number one. Number two is hidden dental abscesses. That's a slow drip from the root of the tooth. It just drips pathogens right into your bloodstream. Another thing is a root canal. So root canal teeth are bad news. So this one people don't like to hear, because they'll go to their dentist, and dentists will say, because they've been taught, you can drill the root out, they fill it, it's fine. It's not true. It's like having a dead finger on your hand. No doctor would ever let you walk around with a dead finger on your hand and just say, oh, we're just gonna, keep giving you antibiotic shots so that way you can keep the dead finger on your hand. No way. It's gonna become gangrenous, and you need to get it cut off. Having a dead tooth in your mouth is exactly the same as having a dead finger on your hand. It is a slow drip of pathogens into your bloodstream that makes it to your heart. So I highly recommend for everyone, one of the best things you can do to reduce your risk of a coronary event is to get rid of your root canal teeth. You have to have them extracted. And so there's a lot of information on this out there. I am a member of the International Academy of Oral Medicine and Toxicology, mainly, which is a sort of like the naturopaths of the dental world, right? And they're amazing people. I love them. There's not too many NDs or MDs that are members of this dental organization, but I am, because heart disease is one of my focuses, along with other chronic degenerative diseases. And so since your mouth health is so important to your heart health, I decided I needed to learn from the people who are on the cutting edge of this, and that's the IAOMT. So if you go to their website, the IAOMT's website, you'll see tons of research on their take on root canals and how you should have them extracted. And okay, so what can you do about your oral hygiene? So now we know what the problem is. What can we do about it? How am I doing? I'm doing great. Okay, so change your diet. So there are people in Aboriginal Australia, and they don't brush their teeth at all, and they don't have any cavities. So it doesn't make any sense. So, what causes, quote unquote, bad bacteria to be in your mouth in the first place? Well, it's mainly what we eat. That's what it is. That's the number one thing that creates a microbiome of bacteria in our mouth. A lot of us have heard of the microbiome in our gut. Well, we also have microbiome in our skin, in our ears, in our nose, and in our mouth. It's like little microclimates of bacteria that, we harbor on our body. And so one of them, microbiome in our mouth. And the best way to change the microbiome in your mouth, and that's to have good bacteria, is to change what you eat. Well, we're not going to change what we eat completely. We're not going to go start hunting antelope and eat what they eat in Aboriginal Australia, whatever that is. So we're sort of constricted a little bit. Even if we eat super healthy, we still are going to have largely the same microbiome. But you can affect it positively by eating less carbohydrates. That will, because it's the bacteria that feed on carbohydrates that create the really bad bacteria that cause the heart issues, right? So you can affect it by what you eat. Okay, so you can also remove the toxins and food particles that feed the bad bacteria. So that would be brushing your teeth. That's how you remove it, right? So make sure you brush your teeth, especially after a high carbohydrate meal. So like let's say you're gonna have pizza or something like that, make sure before you go to bed, especially because your mouth is closed, so there's no oxygen in there. Oxygen will kill the bad bacteria. So that's, I guess, one benefit of being a mouth sleeper if your mouth is open. But most of us keep our mouth closed when we sleep, and that is a perfect breeding environment for the bacteria that's feeding on the carbohydrates that's still in your mouth. I don't know how many of you have used a water pick, but if you don't floss regularly and you just do it very occasionally, then that can damage your gums and cause bleeding, which is an open wound, which is what we're trying to stay away from. So I would recommend instead a water pick that's more gentle on your gums and it won't cause the bleeding as much. And so, and you can do it, I would recommend doing it every day, but if you don't, it's not going to cause damage to your gums if you suddenly start using the water pick. So that's a good thing to use. How many of you have ever heard of oil pulling? No one? Okay. Oh, good. So I new audience here. So oil pulling is something that's used a lot in India, and it's been proven to work really, really well at healing gums. So I have a lot of clients who their gums are just in horrible condition. In fact, my twin sister has had to have antibiotic shots in her gums because she had such unhealthy gums. And I have a gum regenerative protocol that I've put together through the years, and it works really good at completely healing your damaged gums. And it's all naturopathic, so it's not using any antibiotics at all, and you'll even start regrowing your gums if they were receding, which is a fantastic thing. But oil pulling is a major part of it, and like I said, it's started in India, and it's where you basically take sesame oil, although I have now, you can also use coconut oil, and I prefer coconut oil because it has a antibacterial quality to it. You just get a little, like a teaspoon of coconut oil, and you dip it in a xylitol powder, which I'll explain what that is in a second, and then you put it in your mouth. You don't swallow it, you let the coconut oil melt in your mouth, and then your saliva will mix with it, and then you just sort of swish it around and push it in and out of your teeth and just swish it around. And you have to do it for about 5 to 10 minutes. 10 minutes is preferable. And it will pull the toxins out of your tongue and your gums and in between your teeth, and it will help change the microbiome in your mouth and heal it. It pulls toxins out, and then you have to spit it in the trash can. And so don't spit it down the sink. A lot of people do this in their shower, and then they spit it down the drain, and then it'll clog your drain because it's coconut oil. It will re-solidify. Do not do that. Make sure you spit it in the trash can. But it works really well at regenerating your gums, and it's a big part of the protocol. Okay, so another thing, how do you support a healthy microbiome in your mouth? Well, so the xylitol powder, I mentioned that I dipped the teaspoon of coconut oil into xylitol powder before I let it melt in my mouth. So xylitol is a sugar alcohol, and I don't recommend eating it, like ingesting it. I'd say like swallowing it. Most sugar alcohols cause digestive distress, so you don't want to consume it regularly, although you will find that it's in a lot of gum, and the reason why it's in gum is for the exact reason why I want you to use it for oil pulling. And xylitol, for the reasons that are too complex to explain, the bad bacteria in your mouth do not like xylitol at all. They hate it. And so what happens is they die right away. And it's an anti-adherent. So studies have proven that in our mouth, especially on our teeth and around our gums, we have little microfilms, these we call them biofilms, that sort of cover around the tooth. And it makes it really difficult for us to get the bacteria off the tooth, right? It wants to just stick on the biofilm. Well, and so that stickiness of the bacteria, that's the adhesion quality, and xylitol is an anti-adherent, so it makes the bacteria let go, and so it disrupts the biofilm that's on the tooth. So it's really great for mouth health, absolutely fantastic for mouth health. And so that's why I recommend you. Now, I also recommend, let's say you're traveling and you're going up to dinner and you get back to your hotel room and you're like, I'm too lazy to brush my teeth or whatever. That's fine, but at least put a pinch of xylitol powder in your mouth, let it dissolve, swish it around, and spit it out, because that will change the microbiome in your mouth, and it'll help protect your teeth and your gums and all of that. So xylitol powder I take with me everywhere. I have a little like Carmex, old Carmex lip balm container that I'll put it in, and I just take it with me everywhere because it works really, really well. And I might revisit this topic in a second as well. Okay, and so you can also, if you don't like that idea, just having a powder, raw powder there is just too much weird, then you can get gum. So any store will have gum, and a lot of gum now has xylitol in it for this exact reason. So just after you eat, you're going to eat a high carbohydrate meal, chew gum, even if it's just for 1 or 2 minutes, and then you spit the gum out, you're going to get that xylitol in your mouth.